Hi, it's Erica Grotto at HFMA's annual conference in Nashville. I'm very excited now to be joined by John Bullington from Oracle. Welcome.
Thank you.
Let's jump right in here. What is Oracle doing to positively impact healthcare?
Erica, we have a unique opportunity to solve healthcare's challenges holistically with world-class technology, scale, and unmatched experience and expertise. Across the industry, there are workforce shortages, there are cost challenges and increasing consumer expectations, and a need for faster clinical discovery and more informed population health management. That is why we are connecting and unifying the data from across the healthcare ecosystem. So we're the only organization in the world to tackle this problem at scale. To do this, we're building an open, intelligent, cloud-based healthcare platform that brings together healthcare providers, payers, life sciences, public health, and consumers. This platform will integrate the EHR with enterprise applications such as enterprise resource planning, supply chain, and human capital management. It will bring in outside data from trusted sources, including social determinants of health and community risk information. With the combination of Cerner, Oracle's health portfolio is how we start achieving this vision. It will also take partnerships with healthcare organizations, with innovators, with researchers, governments, and more. Ultimately, our work is to make healthcare more accessible, affordable, and equitable for everyone around the world.
So you mentioned lots of different types, different entities across the healthcare continuum. I'd like to focus in a little bit, HFMA being a finance organization. We're here at the annual conference. We're talking about finance. So what is Oracle doing specifically for the finance folks?
So Oracle has solutions for the Office of Finance. A lot of people think of Oracle as technology or ERP. We're actually both and more. Oracle has a complete suite of cloud SaaS applications for the Office of Finance. We have built this integrated application suite to enable healthcare organizations to implement consistent processes and a single source of truth across the most important business functions, from enterprise resource planning, human capital management, supply chain, and enterprise performance management. These cloud applications are intended to work seamlessly, together with the extensive out-of-the-box best practice functionality delivered while allowing the flexibility to configure to your organization's uniqueness. In particular, for the audience of the HFMA conference, our Enterprise Performance Management Suite offers a great deal of functionality that solve problems that keep CFOs up at night.
So tell me more about the Enterprise Performance Management. I want to hear more about that.
Yeah, so the Oracle EPM Cloud, or Enterprise Performance Management, is uniquely different in that it is a suite of interrelated processes on a common platform. So everything you need in the office of the CFO. There are 5 key pillars or business processes that are critical to the office of the CFO for any healthcare company. The first is connected planning. So delivered best practices for planning at a healthcare provider, including long-range planning, including operational planning, including rolling forecast, and capital planning. While we're delivering best practices and out-of-the-box content, what differentiates us from others in the marketplace is that the Oracle EPM solution is easily configurable to meet the unique needs of your organization. The second is close with confidence. The Oracle solution provides a set of business processes to help companies expedite the closing of the books and best practices for close processes. One example of this is a robust solution for the account reconciliation and high volume transaction matching, usually where most time is spent during the close process. The next is cost accounting and service line reporting to help understand the cost across the episode of care, helping organizations identify cost variations and identify cost savings opportunities. Reporting. This is the last step for all the previous process that we've just mentioned. Easily understand what is happening in the business via configurable dashboards and easily collaborate with the broad organization to produce reports and books of reports for internal and external constituents. Aligning enterprise data. So this is foundational, really. The solution enables an organization to streamline metadata, updates, and data governance across the entire ecosystem. And outperform with intelligence, using artificial intelligence that is embedded into each of the processes that we've just discussed, letting the application do the heavy lifting so that people can make informed decisions. Innovation that matters. We are the only technology company in the world with applications to support enterprise workloads. We're also the only scalable application company in the world that owns and manages the underlying technology.
So we're talking about a lot of big things, right? There are so many big challenges. I think we've only kind of scratched the surface. So if people take away just one thing from this interview, what do you want that to be?
Erica, that's real simple. Oracle is passionate about healthcare and committed to the success of our healthcare customers to enable them to provide accessible, equitable, and affordable healthcare.
Definitely a good goal to have. So thank you so much for joining me today.
Thank you.